Hoffwn gyflwyno aelodau annibynnol o'r bwrdd. I would like to introduce the independent members of the board. A'r prif weithredwr ac aelodau gweithredol ac anweithredol o'r bwrdd. And the board chief executive, executive and non-executive board members. Hoffwn gyflwyno yn awr gadeirydd y bwrdd, yr athro Donna Mead OBE. I would now like to introduce the chair, Professor Donna Mead OBE.
Diolch, Non. Prynhawn da pawb, o croeso cynnes iawn i chi gyd cyfarfod hwn heddiw. Mae ddrwg gen i am y ddechrau hwyr. I'm very sorry for the late start. We have been trying to address some IT issues which prevented some members of the public dialing in. And so, as I say, I do apologise for the late start, but we thought it was important that those members of the public would express an interest in joining us. We did everything that we could to enable them to do so. This is an extraordinary board meeting, meeting held in public. And the main agenda item today is that we approve the strategic case, which is a component part of the full business case for the new Velindre Cancer Centre. I have apologies from Jazz Abraham, Kath O'Brien and Steve Ham. Are there any other apologies that I'm not aware of? No? Oh. Oh, that's because I'm speaking, is it? Yeah, okay, thank you. And we have in attendance today, and thanks to all those who are attending, Kate February, Audit Lead from Audit Wales, Stephen Allen, Regional Director from Llais Cymru, David Cogan, our patient representative, and then David Powell, who's the Project Director for the new Cancer Centre, and Mark Ash, who's the Assistant Project Director. Are there any declarations of interest pertinent to the items on the agenda which need to be declared, please? No. So we are meeting in person in Trust Headquarters, and we've got a number of colleagues that have joined us virtually. So when we come to participation in the meeting, please raise your electronic hands, and Board Secretary and I will try and make sure that we call you in as your hands are raised. So thank you for that. This is an important meeting in which, in public, we look at the strategic business case for the new Velindre Cancer Centre. And I first of all want to put on record my thanks to everyone for all of the hard work that's been involved in getting us to this place, and it has been a considerable amount of work of the team to get us to this very important place in the process of moving forward with the new Velindre Cancer Centre. So if that can be put into the minutes, please, I'd be very grateful. And if Carl, as acting CEO, if you could pass those thanks to the board on to staff members concerned.
Thank you, will do.
Been a lot of hard work. So, section 2 of the agenda is Transforming Cancer Services, the Scrutiny Subcommittee's Chair's Assurance Report to the Board. So, I'm going to hand over now to Stephen Harries, who has chaired the Transforming Cancer Services Scrutiny Committee since its inception in 2018, I think it is, Stephen. Who's going to take us through his assurance report to the board, and we will then note Stephen's opinion. Thank you, Stephen.
Okay, thank you, Chair. And in preparing for this meeting, I think we all agreed and recognised how important it was, firstly, to remind the board of the process, the governance and the assurance processes we've gone through to get us to this point. But even more importantly, given the understandable and quite appropriate high level of public interest in this, it's also an opportunity just to assure the public about what we have done in terms of governance and assurance to get us to this stage, because obviously the board you're seeing a very completed product. There's been a huge amount of work gone on in the background in preparing it, and there's been an almost equally huge amount of work gone on in the background in scrutinising and assuring it before it gets to this point, which I'll come to in more detail. I'm just going to take us gradually through the assurance report that I've prepared, because I think it's important just to set all of these details out. They'll be obviously in the minute as well. So as a reminder, or for information, the Transforming Cancer Services programme was established by the Trust in 2015, and that is the all-encompassing umbrella programme for, as the name suggests, transforming the cancer service delivery across South East Wales and beyond that into the cancer network. But to achieve the agreed objectives of that programme, the TCS programme established basically 7 different projects, which obviously all interlink with each other. And one of those projects involves the provision of a new Velindre Cancer Centre for South East Wales, which is the matter we're considering today. And for information, other projects include the Radiotherapy Satellite Centre, outreach services, improved digital and equipment capabilities, including, for example, the integrated radiotherapy solution, which we've separately procured and was approved some time ago. We all recognise and understand that these projects are high value, they're high impact, and they are complex and require a very high level of scrutiny as part of the Trust's overall governance and assurance process, and that this scrutiny requires suitably detailed and in-depth consideration of a range of matters as appropriate to each different project. So in recognition of this, in 2018, the Trust Board formally established a TCS scrutiny subcommittee, and that is for the programme and all of the projects, with the membership drawn from and only from the board's independent members. And we can stress you that that subcommittee is completely independent of and distinct from whatever project board and supporting management and meeting arrangements are put in place by the executive and the officers. It's a completely independent subcommittee of the board. So in the current board committee structure, that scrutiny subcommittee reports to the Trust Board via the Quality, Safety and Performance Committee, and it's that committee which receives the highlight reports, and most often those highlight reports also then work their way up to the Trust Board. And as you said, Chair, I have been chair of that subcommittee since its establishment. In terms of the purpose of my paper today, my report is to report on the scrutiny activities undertaken by the TCS subcommittee in relation, and only in relation, to the matters we're considering today, which is the new Velindre Cancer Centre, and to provide an assurance opinion to the board in respect of the matters and recommendations the board is being asked to consider, note or approve today, which is the strategic case and only the strategic case. So obviously when it comes to my opinion, for clarity, is only in respect of the strategic case and the papers and supporting papers the board is receiving in public here today. Coming back to the scrutiny arrangements, obviously the subcommittee has an agreed terms of reference. Membership has remained consistent for several years, it being last changed some years ago following a change of independent members. As some independent members came to the end of their fixed term of office, obviously they're naturally replaced. So in terms of the current membership, the membership is myself, I'm chair of that subcommittee, vice chair of the Trust, and my 2 colleague IMs who are also members are Hilary Jones, who is the independent member for Estates, and Gareth Jones, who is the independent member legal, and both my colleagues are of course on the meeting today. Alongside this, there are always standing invitations for all independent members to attend. Also highlight as well, I put the sentence in, which I don't think does full justice to you, Donna, where you've attended subcommittee meetings wherever your diary is allowed. Just to, I suppose, expand on that, there have been very few meetings where you've not been able to attend. So you've attended as many subcommittee meetings as you could have, and there have been very few where that has not been possible due to other diary commitments, and from time to time other independent members have attended as they felt appropriate, which we will, I think, touch on when we get to the most recent meetings. So in terms of those attending the meetings from the executive and officer side. Then the Trust Chief Executive is expected to attend, along with executive directors, other directors, senior officers, and various professional staff as appropriate. Each meeting's agenda, and that includes the programme director, Carl, programme support staff, various project directors and project support staff, all as required and depending on the agenda for that particular meeting. But due to the complexity of the projects, the project delivery arrangements have identified or appointed very senior project directors, and we know for this particular project and for some other projects, the project director is David Powell, who is also on the meeting today. And the other appointments include suitably qualified and experienced staff, and beyond that, we ensure that we have access to subject matter experts, whether that be clinical, technical, professional, internally and across the Cancer Services Network and beyond. Alongside that, where necessary and appropriate, the Trust has procured and appointed external professional advisors across a range of disciplines. I've highlighted some, the list is not exhaustive, but financial, commercial, ecological, architectural, technical design and construction. And as appropriate, these professional advisors have attended subcommittee. Subcommittee meets as per the published cycle of business of the board and committees. And as required, we also arrange and hold extraordinary meetings of the subcommittee when required to conduct urgent matters of business, and where appropriate, the subcommittee holds meetings in private. For each of the meetings, there's an agenda which I agree in advance of the meeting. The agenda consists of standing items and other additional items as necessary. And within that, we always consider the key elements of the programme and projects, which would include schedules of programme and project risks and issues, and the communications and engagement papers, which are very important. We understand how we're communicating and engaging with the community and with the public, and of course with our patients, and of course the all-important financial reports. Other agenda items I agree is necessary. Papers supporting each agenda item are received and presented and are reviewed and scrutinised by the subcommittee. And prior to the papers coming to the subcommittee, those papers are obviously reviewed, endorsed for approval or noting through whatever appropriate executive or officer mechanism, project board most typically, and certainly at executive level, the strategic capital board and the executive management board, all essential parts of the governance process. So turning now to my opinion, my assurance opinion. So I'm providing this opinion in respect to the scrutiny activities undertaken by the TCS Scrutiny Subcommittee in relation to the new Velindre Cancer Centre project, for consideration of the matters and recommendations that the board is being asked to consider, note and or approve for clarity in this public meeting. And in the event it turns out the matters being considered consist of the strategic case within the business case. So my opinion is in respect of that and only in respect of that. So all of the matters, the one matter being considered by the board, have been reviewed and scrutinised by the TCS subcommittee. And this has taken place, of course, generally over a period of months or years as the various papers and components of the business case, etc., have been developed. But as we've approached this point, this all-important decision point, the meetings have taken place more frequently as matters have progressed to the conclusion. So I'll say I had to write this paper in advance of the board meeting. So the main papers and recommendations being considered by the board today, in other words, the strategic case, have been scrutinised with considerable rigour, in depth and in detail by the subcommittee. And just to expand on that, the papers we will be considering in the private meeting, which follows this public meeting, have equally been scrutinised with considerable rigour and in depth and in detail by the subcommittee at 3 extraordinary private meetings, which were held on the 1st of February, 5th of February, and on the 6th of February. So that's the papers for both the board meetings, the public and the private. And to give colleagues some feel of how rigorous and in-depth that was, the meeting on the 1st of February lasted 3 hours 40 minutes. The meeting on the 5th of February lasted 3 hours and 10 minutes. The meeting yesterday lasted 3 hours and 40 minutes, so kept a few minutes out for breaks. So there were 10 hours of scrutiny in the past 3 or 4 working days of all of the papers, public and private, being considered by the board today. And obviously a part of that scrutiny was directed towards the all-important strategic case. So during these most recent meetings, and this is true of all meetings, in reviewing a very, very substantial volume of papers in the document pack, both for public and for private, the subcommittee has paid particular attention to scrutinising the key assumptions and those within the final business case in particular, the identification and management of major risks, the funding arrangements, financial affordability, and the test of value for money, the procurement arrangements and the proposed commercial arrangements, and the range and nature of professional assurances which have been provided by senior officers, senior professional staff, and advisors internally within the NHS, and by external professional advisors as appointed. Now, in completing its scrutiny of, I put in document pack, in completing its scrutiny of in the case of this board, the strategic case, the subcommittee identified a small number of amendments required prior to consideration by the board or to be noted by the board if there were not time to make those amendments before the board meeting today. Those amendments are all non-material and mostly requested to add clarification or to provide further assurance. And when we get to the cover paper, Chair, then we will look to Lauren just to respond in terms of or update in terms of the small number of amendments that were requested by the committee. So I'll need to slightly modify 3.6 because, as I say, I wrote this in advance of the meeting, not knowing what totality of what was coming here. So having completed its formal scrutiny, the subcommittee formally endorsed for board approval all matters requiring endorsement, i.e. for today, the strategic case, subject to the amendments referred to in the paragraph above being incorporated in the final versions of documents prior to going into Welsh Government for scrutiny and review, and that the board be informed at the meeting of any matters the subcommittee wishes to draw to the attention of the board. I have no matters myself, other IMs may wish to do that, and that any required statements of assurance from senior officers and professional advisors which have not already been received by the TCS subcommittee will be received by the board in the event there were none. And in so doing, the subcommittee also formally noted all matters requiring noting, with no matters required noting. So, in concluding this, as the independent member chair of TCS Scrutiny Subcommittee, as part of the overall assurance process, I confirmed to the board that, in my opinion, the subcommittee has discharged its responsibilities in respect of the papers being considered at this public meeting, thoroughly, diligently, and prudently, and that the subcommittee has sought and has been provided with efficient information sufficient in depth and in detail to discharge those responsibilities in that matter. In concluding this, Chair, like you, I also wish to express a number of important thanks. I obviously want to thank Hilary and Gareth for their invaluable and very determined, quite rightly so, scrutiny, probing, questioning, challenging every aspect. And I say that's the role we've all been commissioned to undertake, and that's the role I am very confident has been undertaken by my colleagues. So I want to say a personal thank you to Gareth and Hilary, who spent a huge amount of time, particularly over the past few weeks, reading through many hundreds of pages of documents. I also want to say thank you as well, Chair, in terms of your attendance at the subcommittee, specifically bringing your own professional background, insight and expertise to the scrutiny and assurance process. That one other individual I also want to say a thank you to. I could go on at some length. I know Stephen Allen is on the call. Stephen is, as we mentioned now, here representing Llais, but I have known Stephen many years, back in the days of the Community Health Council, and Stephen has attended many of our subcommittee meetings, and he's brought his own very important challenge and perspective there representing the public. So I do want to take this opportunity, particularly as I know, Stephen, you are shortly retiring. It's another opportunity to say a huge thank you for all you've done, particularly in terms of your contribution to scrutinising the documentation that we're considering today, but obviously more widely in terms of your role in Llais and CHC prior to that, in holding the trust to account in all that it does for the public. So thank you. And again, thank you to my colleagues, and of course, goes without saying, my thank you to the executive team for being involved in this process. So that concludes my opinion, Chair. So I now pass across to you to take us to the main item of business.
Thank you, Stephen. I think that's a very detailed report which contextualises exactly what we're doing today and provides, in your opinion, the assurance of the governance arrangements that there have been around the production of this document. And I'm very pleased on behalf of the board to note your opinion and the assurance that you're providing to us today. So that takes us to 2.2 on the agenda, which is the New Velindre Cancer Centre, the actual strategic case within the FBC. You'll notice, colleagues, that there's a very detailed cover paper which goes alongside the strategic case. And so I'm going to ask our board secretary, Lauren Fear, to talk us through some of the key governance aspects which are set out in that cover paper. So if you could walk us through that, Lauren, and then we'll move to ask David Powell to talk to the strategic case itself. So if I can hand over to you, Lauren, please.
Thank you, Chair. So as Stephen has mentioned, the strategic case will be considered in this meeting, and the remaining 4 cases will be received in private at this stage, given we're still in a live procurement process, so that continues to be commercially sensitive until financial close. And then to also confirm that we will publish all 5 cases when they are finalised on the Trust website, as we would for any business case. The cover paper goes on to introduce the case itself and confirms the structure in accordance with the Treasury Green Book guidance, the purpose of the case being the case for change and to demonstrate strategic fit. And then it goes on to summarise the management and governance arrangements, which Stephen has also explained. Section 2 takes us through the summary of assurance of the full business case, the confirmation of compliance with the Treasury Green Book, and then just pause on the matters raised by the Scrutiny Subcommittee, which we held on this matter on the 1st of February. So as it says in 2.4, the items that the Scrutiny Committee raised have been addressed in this version, and the track change version has been sent via separate cover to members, so that there's that reference point that the changes are included here. Those that are so 2.5 then are those matters where we are responding to questions raised by the Scrutiny Subcommittee, but were not actually resulting in track changes. So those are set out in 2.5. And that's all I was going to say up front, unless anyone has any questions on the process, Chair.
Thank you, Lauren. So if there are any questions on the process, which we can address to Lauren, I'll take those now, please. I can't see. Oh, yes, Stephen Allen. Stephen, please.
Thank you, Chair. I'm just trying to find buttons on my screen. I do apologise, and thanks for those comments. I don't want on the process, so again, if I'm out of order, please correct me. The cover paper is very heavily using acronyms that, unless you're in part of the process, and I've been fortunate to be part of the process, you'll understand what they mean. There would be really helpful to have a glossary of terms so the public and people looking at this in the future could actually understand what you're referring to, because I don't think you've actually explained every acronym that you're using. And I want to come back on one other point, if that's okay, Chair, and that's the Equality Impact Assessment. It says extant program EQIA. Can you just explain what that means? Because is there for example, is there an EQIA available on the whole program, or is it broken down per area of work you're doing? Because it's really important, because on SAT, for example, you may have one cohort to consider. On the New Cancer Centre, we have a different cohort to consider. So therefore, there should be what I would class as separate EQIAs that should feed into an overarching model. I'm not saying, but I couldn't work out what you were saying there. If that makes any sense. I hope that's in the right position, Chair, to actually raise those points.
Thank you, Stephen. As always, we will provide a list of acronyms, and that won't be any problem. We'll add that to the to this version of the paper, which is on the website. Yeah. If I can turn to you, Lauren, for the quality impact assessment.
Yeah. So the equality impact assessment. Yeah. So so there is an overall programme, equality impact assessment, as the paper says, Stephen. In addition, the full business case itself has a schedule which addresses the equality impacts of the MVCC, sorry, I'm doing it now, the New Velindre Cancer Centre scope within this case. And David, I don't know if you want to comment, because you and your team have been working on the translation of that information in the business case into the equality impact assessment template.
Yeah, so it is, as you said, Lauren, so we're basically turning that into the standard template, and it is just for this case.
Just to add one further point to that, Stephen, as you say, we got program, we got project. The other thing, let's not forget, these things aren't isolated from the actual service. Yeah. So within the IMTP and our service arrangements, we're doing, and always will, EQIAs on that continually. And also Nicola's on the call, and for the first time, following the new legislation, obviously, quality impact assessments as well. So all those things come together, Stephen.
Chair, can I just come back on that one point if that's helpful? Because I'm looking at the full business case and I can't see in the table of contents where it mentions the EQIA. It may be further down, I'm not saying, but I haven't been able to find it at the moment. So again, I'm just asking for a question because obviously from a scrutiny point of view, that really takes account of the cohort of individuals who will be using the service. And obviously it covers the social economic duty, covers all that aspect as well. I take your assurance from David that it's included in there. I just wanted to clarify, it may probably need a bit more of a heightened awareness of where it is within the documentation.
Yes. Yeah, we can provide that signposting, Stephen, as you suggest.
So we're happy to do that, Stephen. Thank you, as always, for raising that as an important issue. We've kind of lived and breathed with this for so long, and it does sometimes take another pair of eyes to point out the obvious. But as I say, we've been working through these documents for some time. Thanks, Stephen. We will do that. Nicola, please.
Yeah, so just to expand on what Carl's point was just now, is obviously under the duty of quality responsibilities, there has been a full quality impact assessment undertaken in respect of this as well.
Thank you, Nicola. I can't see any other hands up, so I'm going to ask David to take us through the strategic case, please.
Thank you, Chair. So if I just go through the sections, I'll just introduce each section and just give an explanation of what we've got in them. So section 1 is the introduction and the purpose of the case. And in this section, we describe that it's a follow-on from the outline business case. And that was approved by government back in March 21. Yep. And essentially the purpose of the full business case is what we're doing is we're looking again at the assumptions made when we signed off the outline business case, and we're looking at how we stand now. So there's a bit of a refresh. So we do actually bring some of the information back just because it's a long time. So we're bringing some of the information back so people are aware of the context of the development. And then what we do is we look at whether there's anything that needs updating. So has anything changed? So has the context changed, etc. So we're basically looking at what was the context of the case back in March 21, and then have there been anything, any change to the context of the case, the strategic context. And what this case, the strategic case is basically doing is laying, say, the outline for it, so it doesn't get into the nuts and bolts of how the building works, etc., etc. But it just lays out that the parameters of which we're working. So section 1 lays that out, describes for the reader, hopefully clearly, that that's what we're trying to do with the case. What section 2 then does is looks at the structure of the strategic case, and so it outlines how this thing is put together. And I thought the three key things that we looked at the time, which we've brought back here, but there were, and it will come back, be a recurring theme, and it's mentioned by Stephen, but we're part of a program. So there's a program development, which includes other developments. And this is the physical infrastructure in the middle of it. But what we draw out in the structure section is the fact that alongside this case, and we identified in the outline business case that we were looking at an associated equipment strategy. So there was a piece of work picking out what we were going to do with our big equipment. And it's a feature of this particular development in Velindre that there's a lot of equipment. So as a ratio of hospital development, the equipment is a big piece of this. So what we've outlined in the outline business case, and we've come back to here, is just reinforcing the point. There's an equipment strategy which comes alongside this. So as the building develops, I'll come back to it later on. There's a rack of equipment which is being refreshed, developed, and we're taking advantage of the new developments in equipment, and it's a major driver as well as a piece of this. The second thing we draw attention to in this section is the digital strategies, because again, a key part of this very technical sort of healthcare that we provide here at Velindre is the digital side of it as well. And what we draw on here, we did the business case, is the suite of digital strategies which are going alongside this to enable it. So there's a whole set of work which is going on in parallel. And so we're identifying that fact that we did outline business case and it's been developed. And then the third one is the environmental and sustainability set of strategies that the organisation has been working on, and we draw on those. And we knew a certain amount when we did the outline business case, but we know a lot more now. Now we've actually got the products of what we've drawn out in the strategic case here is a lot of the information which you've seen in some detail actually in here about the carbon and our attempt to dramatically reduce carbon, how we managed to do that, the fact it's an all-electric hospital, etc. So the fact we've got lots of, we have some more development in that space. So we introduced it in the outline business case, but what we're doing here is reinforcing what we managed to do. So that's section 2. What section 3 goes back over the existing situation. And as you'd expect, not much has changed in the period. I know a lot's changed in the world, but in terms of the actual existing structure that we've got, that we outlined in the outline business case, it's broadly all as we described. And so in this section, what we do is we talk about the what people know, the existing structure, the fact that around about a third of the building itself has got a category CD in terms of its suitability. The fact that 29% of the building goes back to pre-1965, so back to early Cliff Richard days. So we're going back a long time for a lot of the buildings. So it draws on the fact that we've got a lot of historic building which has got these C's and D's categories to it. Then what section 4 does is it then comes into the case for change. So what it does is it draws on that. So it draws on the existing, what we've got with the opportunity, and then looks at what the opportunity we've got with the new development. So it pulls into the case then the fact that we've got opportunities now with the new hospital to be totally compliant with health building notes, to be totally compliant with health technical memorandum, that allows us to increase our capacity. So it allows us then to put in place capacity which would support growth of services, but also to allow the spaces that we get people to work within and patients to come into to be appropriate for their needs and their care. So that's drawn out in the case for change, and you can see there's 4 sort of strategic objectives in there that we're signalling that we've got the opportunity to meet as part of the new development. And then what section 5 does is goes into the business needs, and it particularly then drills down into the 2 key areas really in terms of the environment. So what it does is it looks at the suitability of the existing accommodation. And I know a number of people, we've been through this, but again, it just for the anyone who's reading this case, we're going back over what it is that we've currently got in terms of the environment. So we looked again at that, and that has not changed much in the intervening time. So what we've got is we've got a lot of accommodation which doesn't allow the right departments to be next door to each other, so people have to travel around to get from one part to another. The fact we've got very cramped spaces, the fact it's very difficult to move around, operate in. And we summarise the existing accommodation with the 17,000 square metres we've currently got. So that's all in the business needs in terms of the style of accommodation. And then we revisit the activity and capacity, which we did as those people around the time remember that we did a big analysis on this for the outline business case. So we analysed all the main lines of activity. And we looked at what our predictions were for growth, which we were then looking then to build our scheme around. And generally, if you look at our daycare, our outpatients, our inpatients, etc., then we had these lines of growth, 2% being a common factor in there. And what we've done in this case is we've gone back to that and had a look at it. So we thought, well, we're now, that was back in the day, so that was back in 21. So are the growth lines that we're experiencing as part of the service are consistent with what we were expecting to see at that time? Basically, bear in mind we're 3 years in, so we checked back on that. And as you can see in the case where we've analysed that, yes, it is, interestingly enough. So we were getting to a point where the growth lines in our main lines of activity are following the trajectory that we anticipated at the time. So it supports the planning. Clearly, we're only 3 years into a programme, but it shows that those growth lines are being are coming to pass. So those two things are drawn out in the business needs section. We then come back to the scope, which we talked about previously, but the fact that the project itself sits within a scope of programs, which includes the equipment replacement, includes the new satellite development, includes outreach services, etc. So we come back to that and reconfirm that that's the scope that the case is sitting in. And then the last piece of it is the benefits section, number 7, where we look at the benefits that we're looking to accrue from the scheme. And we've got a table in there which looks at the different types of benefit that we're looking to draw from the scheme and how we're going about doing it. So I think it's a useful way of trying to summarise it. So what we've got in there is we've got some cash releasing benefits, we've got some non-cash releasing benefits, we've got some societal benefits, etc., which are drawn out in the table. And that is essentially the strategic case. So in summary, then there's then a sort of conclusion, but essentially what it's doing, it's relaying the context for the development. It's almost restating what we said in the outline business case, but also checking whether or not we're still in the same place, that nothing material has moved on. For example, those growth assumptions that we had. And Chairman, if I can hand back to you, that's my summary of the case. Happy to take questions.
Thank you very much, David, for talking us through that. And colleagues, please note the appendices at the end, as David has mentioned them. Are there any questions or queries for David? Stephen's hand is first up, so I'll go to you, Stephen, straight away.
It's not so much a question, Chair, just to follow on from David's comment, that one of the things that we did dig into in TCS Scrutiny Committee was the assumptions around those, because they had sat there for some time. And as Lauren has already reflected in the cover paper, that was something we did want to revisit, which has been revisited. And as David has just explained, the strategic case as presented now reflects the position after that challenge at TCS Scrutiny Committee.
Sure, and there's a sort of 5-year gap between the OBC, and
correct. Yeah, so we wanted that tested.
We wanted it to be tested again to see if it was still up to date, which we have found that it is. Thank you, Stephen, for that. Vicky, please.
Thank you, Chair. I just wanted to pick up a question with David on section 2.5. So this picks up the range of evidence to support the incidence of cancer and some of the figures for outpatient and inpatient facilities. Has this been considered in wider regional meetings? So I'm referencing the Regional Cancer Programme Board. So have those recent figures, the updating of those figures, have those been reviewed, peer reviewed?
That's probably a question I'm not the most qualified to answer. I don't know if Carl, that would be one for you.
Should Carl answer that? I think that would be Carl, please.
Yeah, that'd be helpful. Thank you.
Yeah, really important question. So I think it goes back to the earlier point. So the business case is a function of our MTP plan. So that's the starting point, isn't it? So they're updated regularly. This business case and those plan assumptions goes through what was South East Wales Cancer Collaborative Leadership Group. It's a bit of a mouthful, but it's been all the way through that process. So the answer is yes. I guess the bit I just wanted to draw a slight different point related to that was, of course, the incidence of cancer is one thing, but I guess the bit we're really interested in as well is the function of that is really what does it mean for tertiary services in respect to the ones we provide. So, for example, SACT radiotherapy. So you'll see assumptions in there which hang off that overall cancer incidence. Because let's not forget, we're at the tertiary end of the pathway. So so that's also been relooked, refreshed. And importantly, I think the other thing to draw everybody's attention to is the fact that the cancer centre we hope we will build will always have a finite capacity, because it's only a certain amount of physical space. And the only way in which we can maximise that is to either go longer days of the week or longer hours of the day. So that's one flex. But importantly, I think, drawing back to the model we talked about a little earlier, in general UK healthcare terms, the intention is to move things from right to left. And just to explain what I mean by that for those who aren't so familiar, whereby we're trying to provide as much care at home where appropriate or in the community, and only then ask people, patients, families to travel for highly specialised care. Because ultimately, I think if you look at something similar, so the unscheduled care system, no matter how big you build an A&E department, it will be full unless you service the demand in a slightly different way. So that picks up David's earlier point about helping patients tell us what is best for them. How we support that with technology, and I'll give you an example as well. So SACT used to have to come to the cancer service. You can now take an oral SACT tablet. So that's one example. So it's all based on moving care from right to left, Vicky. So those assumptions have been tested. They are in our IMTP, and they're also then related into the regional aspect, because of course we need to plan as a cancer system across South East Wales. So a long explanation there, but I think the point is, yes, they have. It's also important to note the model of care, which is the model of care we currently deliver, but want to go a bit further after what patients have told us. And then last but not least, they're only assumptions are only good for the time in which you make them, aren't they? And already we've seen some growth in SACT and radiotherapy. So we'll have some flexibility both in terms of the hospital we're building, but also moving further into outreach and doing more at home. So I hope that answers your question.
That does. Thank you very much.
Thanks, Vicky. Are there any other queries or observations colleagues wish to make? I can't see any hands up at all. So we've had the opportunity to read the strategic case. David, thank you for talking us through it. And what the Trust Board is asked to do today is to approve the New Velindre Cancer Centre strategic case as it will appear in the full business case in due course. So I'm asking, please, for colleagues to approve the strategic business case. I can see the IMs, I can see some execs nodding their heads. Confirmed? Yes. Confirmed. So I think that is pretty unanimous. You can't be pretty unanimous. You're either unanimous or you're not. But I think that's unanimous. And it's important to record that that's unanimous. So we've approved. This is a moment in time which I want to savour to some extent, because there's been so much work and aspiration and hopes that have gone into developing this over many years, and we've arrived at this place today. I'm feeling a little bit emotional, if I'm honest, that we've got to the stage where we're approving the final strategic business case. So if we can note that approval, please. And that brings us to section 3, which is any other business. I've not been informed that there is any other business. So thank you to everybody that's participated, both today and in the lead up to this meeting today. And I apologise for the late start. I do hope that our members of the public have been able to join us. Board Secretary confirms that some of them have, so that's really important. But with that, I'll close this public meeting. Thank you, colleagues.